Hello guys, welcome to my channel. My name is Isaac, Simple and Real. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infectious stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Welcome. Guys, if you're new to this channel and you have not yet subscribed to my channel, please subscribe, like and share. Thank you guys. I've talked about HIV in so many instances, and I've tried to make presentations that will educate you more about HIV and other opportunistic infections related to HIV. We have talked about how you can be HIV positive taking your drugs, and you cannot, so to an extent that you cannot transmit the virus even if you have unprotected sex with a person who is HIV negative. We have also actually without taking any other method, which we call treatment as prevention. Number two, we have talked about other preventive methods like use of pre-exposure prophylaxis. We have also talked about use of post-exposure prophylaxis, that is PEP. We have also talked about use of condoms, that is barrier methods. And these are just but some of the things that you can employ either you are in a serodiscordant relationship or you have a sexual partner, you do not know their HIV status, in a way that you yourself you will not acquire the virus. Now, in my last video, I was able to discuss something called condylomata acuminata or genital warts, and I thank you guys. You had a very positive response, and today I decided to talk about an opportunistic infection that is more respiratory. In our topic today, we'll be discussing about tuberculosis. As a country, we are planning to eradicate tuberculosis by 2027, but will we be able to achieve this? Let's see and let's learn. Let's see what the government of Kenya has done, and also let's see other ways that you and me can contribute to achievement of eradicating new cases of tuberculosis by 2027. Did you know that TB inatiba? Now you know. Let's learn. TB or tuberculosis exists in a human body in two forms. Number one, you can be having latent tuberculosis, or you can be having active tuberculosis. Now, latent tuberculosis is a type of tuberculosis whereby your immunity or your immune system has engulfed or has enclosed the tuberculous bacilli in your chest or in your lungs in such a way that they do not multiply, although they are not dead, but they do not multiply. In this case, it's like the TB bacteria is sleeping, it's not replicating, and it's not dying. It's just like it's just sleeping without multiplication. Now, latent tuberculosis does not harm anyone except when your immunity is compromised. That is, when your immunity goes low, either you acquire maybe malnutrition, diseases like HIV, which is immunosuppressive, cancer, diabetes. If you have this, you acquire these immunosuppressive diseases. Now, the latent tuberculosis will now manifest as active tuberculosis. Now, latent tuberculosis is treatable. Now, ask me how. Now, let's learn together. We have this kind of drug. Now, I am not sure if you can see it clearly. Let me just open it. This drug. Now, this drug is formed by a combination of two drugs. That is rifampicin and isoniazid. These drugs are believed to be very effective, especially in killing or destroying tuberculosis that is in its latent form. They are good in killing these bacteria. They are bactericidal, and they destroy or they kill these bacteria that are not multiplying but are sleeping, or they are inactive in your lungs. How are these drugs taken? These drugs are taken especially for persons who are above 40 kilograms. They are taken 3 tablets, that is 1, 2, 3 per week. So you take, like for this one, you take it for 4 weeks. For a complete treatment of latent tuberculosis, you require the 3 of them. That is because you treat latent tuberculosis for a period of 12 weeks. Are we together, guys? This is how we treat latent tuberculosis. So you can be healthy as I am, and especially for healthcare workers. Now, let me talk about those who are eligible for treatment for latent tuberculosis. Number 1, a health worker like me. Why? A person like me, I attend patients who are I'm suspecting they could be having tuberculosis, or those I'm sure they are having tuberculosis. When they cough in my office, the bacteria are left circulating in my office. Especially, even if I have opened the doors and the windows, still there will be some remnant bacteria that bacteria that I will inhale. Now, when I inhale this bacteria and my immunity is competent, this bacteria will not manifest as active tuberculosis to me. Rather, my immune system will engulf or enclose these bacteria to my lung. They will form some things that we call the Ghon focus or Ghon complexes, which in turn we describe them, which we now describe them as latent TB. Now, when you do a chest X-ray on me and I'm having latent tuberculosis, you will see nothing until my Ghon complexes eat my lung up and form a cavity. So for you to diagnose that I'm having an active tuberculosis, you will be looking for cavity, not Ghon focus or Ghon complexes. So you see the difference. So it's very difficult for you to make a diagnosis of latent tuberculosis. However, there are other tests, immunoglobulin, like IGRA test, which uses the immune system, checking the immune response to detect whether you have latent tuberculosis or not. However, this cannot be done to someone who is below 15 years. This is because of the BCG that you took when you were born to prevent you from acquiring tuberculosis, the vaccine. So it has some limitation, especially using the immunoglobulin tests. Now, who are eligible for TB preventive therapy? Number 1, for you to be eligible to to be prevented from TB, that is, people or someone who has been diagnosed with latent tuberculosis. If you have done a IGRA test and it has turned positive, or you have confirmed that you are suffering from latent tuberculosis, which is asymptomatic in its nature, you are eligible to be started on TPT. Number 2, who can be eligible for TPT even without a test? Number 2 is a healthcare worker. But remember, before initiating on TB preventive therapy, it's always very important for you to be tested for active tuberculosis, because you cannot be treated for latent TB before you are confirmed or whether you have active or not. So all healthcare workers or persons working in a healthcare setting are eligible to be treated or to be initiated on TB preventive therapy. Number 2, prisoners or persons deprived liberty. Prisoners are those persons enclosed in police cells or prison. These people, the reason why they are eligible to be initiated on TB preventive therapy is because of the overcrowding nature of cells and prisons. The likelihood that one of them could be suffering from active tuberculosis is high. So it is very important for them to be initiated on TB preventive therapy. Number 4, those who are eligible to be initiated on TB preventive therapy are TB contacts. Who is a TB contact? This is a person who has housed or interacted or spent time of more than a day with any person who is confirmed to be having an active tuberculosis, especially smear positive or microscopically diagnosed tuberculosis. These people are eligible to be initiated on TB preventive therapy. So we have these 4 categories of people. Other persons that have been added to this category are police and prison officers who are willing to be initiated on TB preventive therapy. The reason is because these police officers and prison officers engage in this with these people either by design or by default, while arresting them, while interrogating them, or while protecting them, or with them in a protective custody, either in a matatu, bus, land cruisers, pickups, and what have you. So these people are by default eligible to be initiated on TB preventive therapy. How do we acquire TB preventive therapy? These drugs that I'm showing here, they are government issued. They are free of charge. So if you are a police officer, prison officer, healthcare worker, at any other TB contact, you can access these drugs. If you are in area within Kirinyaga County, I can guide you. If you are outside the Kirinyaga County, you can get it at your nearest healthcare facility. Your nearest healthcare facility, you can be able to you can get assistance and be initiated on these drugs. Remember, the advantage you will get is that there is less likelihood of you acquiring active tuberculosis. Active tuberculosis, in this case, can be drug sensitive or drug resistant. Remember, a drug sensitive tuberculosis, especially involving the lungs and other parts of the body except the brain, the spine, and the joints and the joints, are treated for a period of 6 months. Other parts like brain, spine, joints, and that is brain, spine, joints, and bones are treated for a period of 1 year. So for you to avoid this active tuberculosis that is treated for 6 months to 1 year, it's more wise for you to be initiated on this preventive therapy that is treated on a weekly basis for a period of 3 months. That is 12 weeks. Number 2, it will be less costly for the government for you to be prevented from active tuberculosis than to treat you for active tuberculosis. It's less costly to you and to the government. Are we together? Thank you. Now, allow me to discuss active tuberculosis. There are several ways that you can suspect that you're having active tuberculosis. Number 1, actually, currently we are saying if you are coughing, even if it's 1 day, go and get screened for tuberculosis. But high chances that you could be having tuberculosis is a person who is coughing more than 1 week with significant weight loss. What is significant weight loss, Daktari? Significant weight loss is a weight loss of more than 3 kilograms in 1 month or less. That's a significant weight loss. How do I know that I have a significant weight loss? Number 1, you could be wearing size 36 pair of trousers, and now it's falling, or you have to tighten your belt for you to be accommodated by the same pair of trousers. Your innerwears is now looking like a short, and previously it was tight on your thighs. You could be having a significant weight loss. So cough of more than 1 week with significant weight loss and drenching night sweat. What is drenching night sweat? Drenching night sweat is a kind of sweat whereby you sleep wearing a vest like the one I'm having. By the time you're waking up, or maybe you're wearing your pajamas, by the time you're waking up, your pajamas or your vest is attached to your skin in such a way that you have sweat to an extent that your vest or your pajamas are wet. This is a drenching night sweat. Or maybe your beddings, when you're waking up in the morning, they are wet, just secondary to sweating. This is drenching night sweat. So in case you're having one of these symptoms, not even the 3 of them, one of them, please, it's very important for you to visit a healthcare facility, get screened for tuberculosis, get tested, and if you are initiated on treatment, if you are confirmed to be suffering, you initiated on treatment immediately. And remember, TB is curable, and those who are diagnosed are recover completely. Now, how does the anti-TB drugs look like? Maybe you have never met them. Let me just demonstrate to you so that you may be able to learn. Now, this is the package of care. This package of care usually covers, it's a full package for those who are below 54 kgs, 54 kilograms and below, for a period of 6 months. However, these are the drugs for tuberculosis. We usually initiate only those who are confirmed to be having a drug-sensitive tuberculosis on these drugs, and we usually dispense them according to the weight of the person or the patient suffering from tuberculosis. What we recommend, if you are you have been diagnosed with tuberculosis, please complete your treatment. Remember, if you do not complete this treatment, if you have prescribed a treatment, a full complete treatment is 6 months currently, especially for adults confirmed with active tuberculosis. So if we confirm that you are suffering from tuberculosis, please, if we have told you that you will be taking these drugs, we usually give this for 8 weeks, and then we have another combination of drugs that we usually give for 4 months. So if we are dispensing these drugs to you, please take them faithfully for your 6 months complete. Remember, if you do not complete these drugs or complete the treatment, there is a high likelihood that the bacteria may get, or the drug may get resistant, or the drug may develop resistance to the bacteria. So the drugs may not be effective for the treatment of tuberculosis. And when we get to this point, the likelihood of our treatment success becomes low, because these people, before maybe we confirm whether they are which drug they are resisting, there is a lot of time wasted and complication may ensue during this period. So this is the reason why adherence is very important. Also, if we say you are taking 3 tablets or 4 tablets or 5 tablets per day, please adhere to that, because the number of drugs that is calculated for you according to your weight is well calculated to cater for your needs. If you are taking less than that, you are increasing your chances of drug resistance and treatment failure, which may lead you to being restarted on second line TB treatment, which again takes more time for your treatment. So these are just but some of the things that are very important to us, and which I think it's important for us to know. Tuberculosis, it's good to know that tuberculosis does not affect only those who are HIV positive. Even when you are HIV negative, you can acquire tuberculosis. You can get infected by tuberculous bacteria. Also, there's something that is very important. If we request you for sputum, for us to confirm the progress of treatment or the success rate of our treatment, please submit those samples. They help us to make decisions, to know whether the drugs are working on you or they are not. Now, this was just but some of the things that I really wanted to discuss. Let me talk about something different that some people in my clinic, they asked me, and which I think it's important for us to know. Now, is tuberculosis hereditary? My answer is no. You cannot acquire tuberculosis genetically. Why? Tuberculosis is a bacteria. It's not autoimmune. It's not actually, there is no relationship between your genes and the bacteria tuberculosis. Actually, to be open on this, we have various types of tuberculosis. It's just that they are not Mycobacterium tuberculosis. Actually, we have various types of Mycobacterium. It's just that they are not tuberculosis. We have the Mycobacterium leprae, we have Mycobacterium avium, and we have Mycobacterium now, the tuberculosis, and Mycobacterium bovis. If they were genetic, I think even these others, the other genus, or I mean the other species, They also could be genetic, but you have never suffered from them. So I'm trying to justify that Mycobacterium tuberculosis is not genetic. Number 2, not everyone who is coughing has tuberculosis. The other way around. Not everyone who is not coughing does not have tuberculosis. Why? Tuberculosis can affect other parts of the body other than the lungs. What are these parts? It can affect your eyes, can affect your ears, can affect your tonsils, can affect your other lymph nodes, can affect actually it can affect all parts of your body apart from your hair and nails. For me, in my practice, I have treated someone with the tuberculosis adenitis. I have treated someone with the tuberculosis retinitis, meningitis, spine, name them, testicular tuberculosis. So it can affect so many parts of your body, and you have no good reason for you to dispute whether it's TB or not. The best thing is to go get tested. If it's tuberculosis, get treated. That's all for today, guys. If you're new to this channel, you have not yet subscribed to my channel, please subscribe, like and share. And if there's something that I've omitted that you think it's important to this channel, please drop it at the comment section. My name is Isaac, simple and real. God bless you.